Good afternoon, everyone. Happy Red Friday. I know we're celebrating a little bit different of a Red Friday, so happy Valentine's Day to everyone. Hopefully you have some really great date plans, either, with your mini Valentines or your big Valentines. Have a safe night out or in. Tonight I just want to reminisce a little bit about our heart healthy month, and today being Valentine's. I just wanted to touch on something that I thought was pretty important when we're dealing with heart disease or any heart conditions. As we know, over 600,000 people die every year of heart disease, number one killer of women, and 1,800 people are gonna die per day just from heart disease. It kind of puts it in a little bit bigger of a perspective. So what I want to talk about today has nothing to do with telling you to drop your cardiovascular medications or ditch the meds or ditch the statins. I just want to educate you a little bit about how some of these medications can cause some nutrient deficiencies. Not saying that you have them, but just little things maybe to watch out for and to be thinking about, and maybe ask your doctor about at your next appointment. So let's go ahead and get started. We're going to start with beta blockers. Beta blockers are a pretty common medication, and they have to do with patients who have tachycardia, so slowing down somebody's heart rate who has an extremely high heart rate. So two of the things that are usually deficient with beta blockers are going to be CoQ10, which we are going to discuss later at the bottom of the message, and then also melatonin. Melatonin, as you know, has to do with sleep. So it helps us get in that nice REM and restorative sleep. It's very antioxidant, and it's actually been shown in studies that those with a decrease in their melatonin have an increased risk of breast cancer. So definitely want to be thinking about that. And then a couple of things that you might think of when you're have some symptoms of this is you might not feel really rested, lack the energy, and maybe some muscle pain as well. So the next one we're going to talk about is the ACE inhibitors. These are used very commonly, and many people are on them. So they are going to bring down your blood pressure. So if you have high blood pressure, your cardiologist is probably going to use with you. So the two nutrients with that one are going to be sodium and zinc. Sodium is the electrolyte in our body, one of the major ones. It has to do with muscle contractions, regulating blood pressure. Most of the Americans today get plenty of sodium in their diet. That's not normally an issue, but definitely something that your doctor will probably test for. It's usually on a complete metabolic panel. And then the second one is zinc. So zinc is really cool because it's required for over 300 enzymatic reactions and functions. So think about immunity, antiviral, decreasing your cold symptoms, sperm motility. Let's see what else. They protect your DNA. Skin issues can come up, so eczema, psoriasis, any of those. And then also if you're struggling with some thyroid symptoms, zinc is beneficial in the conversion of T4 to T3, the active form of thyroid. So with that one, I feel like you're always getting sick, or you might have some muscle spasms, maybe some skin issues. I mean, the list is pretty long on the symptoms that you could have with that. And then the last one we're going to talk about is, of course, statins, right? We all hear about statins and whether they're good or bad or ugly. Not for me to decide tonight, but I do want to warn you of some of the nutrient deficiencies that are very common with the statin medications. So we're going to think carnitine, copper, essential fatty acids, selenium, vitamin D, vitamin E, and then, of course, CoQ10. I'm not going to touch on all of those right now, but I'll touch on a few of them. So carnitine is a really interesting one. I think it's important. People who've tried to lose weight might have heard of it before, but carnitine is the Uber driver for fat to get into the cell and for the mitochondria, the powerhouse of the cell, to make it into energy. So we think ATP from chemistry class. So that's kind of carnitine's big thing. So for people who want to lose weight, they want to be able to burn that fat. So being able to mobilize that for energy is very important and valuable. The next one we should talk about is probably essential fatty acids. And as the name says, it's essential, so we have to get it from our diet. Our body cannot produce it on its own. So definitely increase those orders of Alaskan salmon for your Valentine's dinner. But essential fatty acids, there are many functions, from immunity to mood to brain health to decreasing inflammation. We know that omega-3s can decrease your triglycerides and decrease your blood pressure, and they've also been shown to help with decreasing plaque formations. So if we can keep those plaques from forming in the first place, then we can kind of avoid some of the down the road issues that could lead to situations we don't want to be in. And then the final one, because we saw it earlier up top, is CoQ10. CoQ10 is really neat. It regulates over 170 genes in muscle tissue. So when you think regeneration of muscle tissue, think about the heart. It's pumping 24/7, 365. So it gets one hell of a workout. So we want to make sure that we're getting the right nutrients in to regenerate it and to make it feel good and grow and last us for the next century, right? And then it also has to do with, it's absolutely necessary for energy. It's great it mops up like a lot of the free radicals. So free radicals may be from the environment, and free radicals are like the ping pong ball that goes in our body and creates damage. So we want to get those out of there as soon as possible. And then maybe some, biochemical reactions that happen in our body. There's some waste products that need to be cleaned up as well. So with the statins and some of the things that it has a tendency to you can become deficient in, you're gonna have the low energy, no endurance. Muscle spasms are huge with the statin medications, and you just feel drained. So that's kind of just a quick overview of some of the most common cardiovascular drugs. I have a bigger list, and if you're interested in seeing a little bit more that's on the list, or see if maybe your medication is on there and see what deficiencies might be plaguing you, definitely just message me, hit me up, and I'll shoot that over to you. I think the biggest thing is know that your doctor is not a nutritionist. They're not gonna know these things. They have plenty on their plate, so they're worried about heart functions, EKGs, all that. It's best if you can try to get with your functional medicine practitioner, or maybe a nutritionist or a dietitian to go over this stuff with you. I know in my office we can do a micronutrient test with you that looks at all of your nutrients, not just these, but your B vitamins, your fatty acids, that can give us a really good picture of how you're doing. And maybe you're not on medications and you just want to optimize and be like, okay, what can I do to improve even more? And sometimes you can find some of those deficiencies that you can it's an easy fix, right? Also, my big pointer is if you're gonna do these things, don't obviously get the advice of a functional doctor or a clinical nutritionist, but don't just go out and buy a bunch of CoQ10 and start popping it. I think you definitely, like anything, you need a little bit of reeling in sometimes, and just a little bit more targeted approach. So I hope this was helpful. I hope it enlightens you a little bit and helps you get a little bit closer to becoming your own health advocate. If you have any questions, definitely feel free. Have a fabulous Valentine's Day, and we'll see you on the flip side.